For the second year, Zumbro Valley Medical Society is holding a class to give medical students real-world practice, serving one of the most vulnerable populations in our community, the homeless.
ABC 6 News reporter Alex Cotter explains why classes like this are so important not only for our community, but for the medical community. Alex?
James and Laura, today 23 medical students here at Mayo Clinic gathered for the first time today for what is called the Street Medical Elective class, a curriculum solely designed around educating students on how to provide care to those who often don't have access to routine medical care. This course gets first-year medical students out in the community and provides them with a hands-on experience that they normally don't get in their first few years of medical school. It also builds bridges between healthcare workers and the underserved members of the community.
Like a lot of what we see in medical school, especially in the first couple of years, is very theoretical, very just like you see what the disease is, whatever happens. You don't get that much exposure to patients in general, and you definitely don't get exposure to patients in their own environment.
Jeffrey Wood is a medical student and is one of the co-founders of the Street Medicine Elective at Mayo Clinic. He said he first learned about street medicine last year and was inspired to bring that education and experience to other medical students.
People deserve to have medical care no matter what their housing situation is or socioeconomic status, and there not being something like this in Rochester where we have access to so many medical resources. I was just inspired to see what I could do.
Wednesday, students met for the first class in the 5-month elective course. They broke into small groups and talked with area organizers who work with the homeless and underserved community in Olmsted County. The ultimate goal of this course, for students to pair up with a physician and go out in the community themselves to provide care for those who need it.
To go under bridges, in camps, in order to see what people might need in general, but then also what health needs they might have.
Luqman Ellykhy went through the course last year, and he said he couldn't be more thankful for the experience, and he knows it will undoubtedly make him a better doctor in the future.
This is exactly why I want to do medicine. This is medicine at its purest. You're going down to where the patient is. You're not making them come to you.
Now, people I spoke with today say there's still a growing need to help the homeless and underserved community in our area. In Rochester alone, last year, there were 157 people that reported as homeless. Now, that's 24% less than 2020, but still a pretty high number. Live in Rochester, Alex Cotter, ABC 6 News.